Dr. Thomas Lee, has initiated a whole other program, something I didn't see so much initially, but we're seeing much more pediatric children with retinal diseases, particularly the premature infants. And there's been a whole program now established through Dr. Lee that is really going into the neonatal intensive care units and looking and screening those premature babies, the preemies, for bad retinal diseases. And that is, in my mind, a huge, huge thing that's been going on for the last few years. That is revolutionary for that country, because those were babies that were going to be blind their entire lives, and now suddenly they're going to see and have healthy, productive lives. It's dramatic what they've been able to accomplish.
When we were in Armenia, we had a chance to visit both the Eye Institute there, the Malayan Eye Institute, as well as a number of the hospitals where these children were going blind. The Malayan Eye Institute actually has some very impressive technology that has been developed and brought in large part through the Armenian Eye Care Project. The hospitals, however, were further behind. As a result, children were being born premature, but because the nurses and the doctors didn't have the equipment or the training, many of these children were going blind from retinopathy of prematurity.
As a retina surgeon, Dr. Lee was impressed with the Armenian surgeons who were eager to learn.
Our training program started with 3 days of intensive lectures, teaching them everything from start to finish on how to prevent childhood blindness, specifically in this disease called retinopathy of prematurity. What we found was after the first 3 days, after they had gotten the basic knowledge, we took them into the neonatal intensive care unit where these children were going blind. And I took their top retina surgeon, showed him how we do the laser treatment, and performed that on a child who was actually going blind at the time of our visit. I treated the right eye. I then had him treat the left eye. After we had treated that child, we went on to the next child who was also going blind from the same condition. He treated the right eye, and then when I was expecting him to treat the left eye, he asked if he could show his student how to treat the left eye. So in medicine, historically, we've had this phrase, see one, do one, teach one, which I've never witnessed in my entire life. And yet when we went to Armenia, he saw one, he did one, and then he taught one. And after the 1 year of supervision, which we do over the internet, using a specialized retina camera that the Armenian Eye Care Project purchased, over that 1 year period, we screened 300 babies, performed 1,500 exams remotely over the internet using basically my iPhone or my iPad. And at the end of that period, their level of proficiency, their success rate in preventing childhood blindness from this disease equaled the level that we have here by our US experts. It's amazing the impact that 3 days and then the subsequent follow-up would have. But not in my wildest dreams would I've ever have thought that I would have the ability to have the impact that our team had for that country.